Hiya friends, I am back. For those of you who doesn't know me, welcome to my page. My name is Clau. I'm a wife, a mom, and a nurse. It sure has been a while since I have created a vlog. Some of you knows it, but there are still a few people that are asking, messaging me whenever they see a video that I post about our little girl. It has been a few months that I have focused on the role of being a mom. I love you, husband, but you already know what we've been through for the past few months. Anyway, our little girl, we have named her Resilient Athena, and here's why. So before I continue, I just want to let you know that today is May 2nd. It's a Saturday. Today, my husband and I had recently swapped because of all the restrictions that is happening in the hospital, that only one parent can stay with Athena because of the coronavirus. So it's just a lot of policy that kept changing every day. But anyway, we have finally swapped, and after a month and a week, my husband has finally seen Athena again. So yeah, let's go back to telling you guys what happened. Back in November, our little girl, Athena, a very active child, she loves playing, running around, chasing after cats, has suddenly, like a week towards her admission, suddenly has been falling on her knees, losing balance, and like from what I remember that I told my mom, it feels like she's regressing. But then she said maybe she just wants attention, maybe she just wants more cuddles, just being Athena. And so November 22nd, this was the premiere night of Frozen 2. She loves Frozen. Oh, she loves Frozen. Anyway, when we went to the theater, the 7 and 7:30 showtimes are fully booked or sold out. And so we waited until like 9 p.m. Oh, of course not. We're not going to go home without watching Frozen 2, even though it's past her bedtime. But anyway, since we were waiting at 9 o'clock, or for 9 o'clock, we have decided to just go out to dinner and maybe walk to Best Buy while waiting for the time. And so we did. But when we were walking in Best Buy, like just looking around, my husband and I have noticed that she's still falling on her knees. And even when we were holding her hands, she'd still fall on her knees, and right in the middle of the hallway at Best Buy, she'd lie down, like, good thing it's carpeted, but she'd lie down, and it was just like, what is going on? So my husband and I have been talking that day, since this was a Saturday. No, this was a Friday. This was a Friday. We have talked about it that maybe we could wait until Monday to find out if her primary provider would take her and take a look at her, or maybe like the urgent care, or maybe the ER. So the next day, November 22nd, I was at work. I was checking in with them. My husband is at home feeding her breakfast, and he said that she threw up. And so he tried feeding her around lunchtime again, and she was throwing up. And when I asked about the walking part, she still has that loss of balance. So he was thinking that maybe she has a little bit of ear infection because of losing balance, or flu-like symptoms. But I asked if she had a fever, but he said no fever. She doesn't seem feeling hot or anything, but just like the losing balance and the throwing up part, and it's just not feeling well. Without skipping a beat, I told him, take her to the ER. Do not wait until she has a fever. Just take her. During that time, it was raining. So my mom has offered to go with them, whatever happened. Um, from what my mom told me, when they get to the ER, so my husband dropped them off. She got Athena to drop him off so he could park the truck. She got Athena to the triage nurse, and when she told them, "Look at our baby, she cannot walk." Hold on. So when we go to this hospital, to this ER, I've been to this ER so many times from whatever. Yeah, like from migraine, vertigo, a lot of things that I have been through, and I went to this ER. This was at Womack. Anyway, it takes about like 2 hours to get seen because of course triage and or even go to a room. But this time when my mom said, "Look at our baby, she cannot walk," all of a sudden it changed. Like people already have the wheelchair ready to wheel her into the room. When my husband got in, he just saw them and they were already taking her to the room. And within that time that they were there, like 30 minutes to an hour, they already did blood draws, urinalysis. They even have to put a urinary catheter on her. And they did CT scan. So when my mom tried to like update me while I was at work, and I heard about the CT scan, I was like, how serious is her situation that she needs a CT scan? Yeah. Like, because I've had migraine, I've had vertigo. They tried to say, "Oh, we could go do some CT scan," but they did not. Yeah. So that's why I was like, how serious is this that she needs a CT scan? And they called me back like 20 minutes later. I was at work. I was getting ready to rinse back a patient. When my mom told me, she said they found a mass on her brain, and I was like, "What? Mass on her brain? Sorry, what are you saying?" And she's like, "Get out of work, come over here. This is big." I was like, "What do you mean?" But during that time when she said it was a 5.4 centimeter, what registered to my mind is a 5.4 millimeter. So centimeter compared to a millimeter. Yeah. And I was like, "Okay, hold on. Let me just endorse my patients to my other nurses, the other nurses, and my charge nurse. I have to tell her." And by the time that I was telling my charge nurse that time, when I finally said it, that they found a mass on my daughter's brain, that's when the waterworks came out. It was crazy. To think that it was raining that day. So when she told me, "Come over here now," I was like, I was already crying. I was grabbing my stuff from my locker and I was running to the elevator and getting ready. And it's like trying to press all the buttons in the elevator. No, I'm just kidding. But anyway, I received a call from my husband and he said, "Nope, turn around. Don't come here." Because during that time, they were waiting for two big hospitals. Because apparently, Athena's case was too big for Womack at that time, especially on pediatrics. Let's just say peds. Anyway, her mass was too big for them, so they had to refer her to either Duke University Hospital or University of North Carolina Hospital. And I could not be more thankful that UNC had called to take her case. I don't have anything bad about Duke, but I am so happy that UNC took her case. And within the time that they were from home to the hospital, to Womack, to doing all those procedures for her, to transporting her to UNC is like 2 hours, 3 hours tops. And that was that whole time that she was transported to UNC. My husband told me, "Go back to the house, wait for me. I don't want you driving on this rain." And so I waited. and waited and waited. I think it was about like 8 o'clock, 8 or 9, I think, that I finally got to see Athena that day. And they were trying, I mean, the doctors there were trying to read the interpretation that Womack has done. And they told me they wanted to wait on Monday because this was Saturday. November 23rd. They wanted to wait on Monday, November 25th, to do a sedated MRI so they could see the whole brain and the spine if it has metastasized. And so that's what happened. But the mass was on the posterior fossa. It's like the back of her brain. It's in between of the cerebellum and the brain stem. I could not explain it better. And that's the reason why I have my notes. So I got all of this through my chart. It's an app that they wanted me to download. Well, it's also for us to see the results of her procedures, her blood draws, and like her appointments and all that. And as I was going through all of it, like from the beginning, from November 23rd, and just reading everything, it made me, I don't know, it was just like, I was like encouraged to finally share all of this. It was a lot, and I don't know, talking about it is somewhat therapeutic. As what I've told my husband, just talking about it, getting it all out, sharing her journey, especially now that she's recovering, and like seeing her recover every day is what keeps us going. So back in November 23, when they told me about, when Womack told us about the mass, well, I was not there, but I was reading through the results. They found a 5.4 hyper-attenuating mass within the posterior fossa. It's between the cerebellum and the brainstem. So according to the CT scan, it was a 5.4 by 4 by 2.9 cm mass. The mass exerts mild mass effect on the brainstem. It was resulting obstructive hydrocephalus, because it was like forcing fluid, because the fourth ventricle was displaced and it appears to face. So I don't know what that means, but I was just like getting all this information. And so they wanted to wait until like November 25th, which was the Monday, to do a sedated MRI. And according to the MRI, just to have like a better picture of what was happening and like better plane, according to them, like, yeah, the whole brain and the spine and all that. They wanted to do that. And in order for her to have, of course, like sedative, get her out and intubate her to do the sedation, they had to do an IV, of course. But it took them 4 times to get her an IV. Like after the second time, they said, you know what, let's just give her something to relax her. And so they gave her Versed. And our daughter, whenever she doesn't know you and you come in with scrubs, she'll be like, get out now. It was crazy. Like, she would tell everybody, get out. And so they gave her Versed. But during that time, even when people are like coming into our room, and she would be like, get out. So she was smiling because thankfully Versed. Anyway, they had to do that. And that the lady that actually got a good vein and did a good IV on her was a Filipina, and I'm so proud of her. I'm not sure if I'm allowed to say her name, but I like her. She's a Filipina. And so they did that. They were able to do that. And they did the MRI. They did the brain and the spine. So I also have the results. The MRI of the spine, it says no evidence of metastatic disease within the spinal canal. So it has not spread to the spinal cord, which is amazing. So hearing that from the doctors, it was a relief, because if it was a different conversation. So the brain, though, with and without contrast, it was a 3.9 by 5.3 by 5 cm heterogeneous enhancing mass. So it was a metastatic mass. It was a fast-growing one. In the fourth ventricle, causes mass effect on the brainstem and cerebellum with crowding of the foramen magnum, and supratentorial ventriculomegaly, and it is favoring medulloblastoma. At this point, they have not told us about medulloblastoma, because at that time it was a resident that was talking to us. Of course, they wanted to talk to their attendings and all that. And if you're watching Grey's Anatomy, or if you watched Grey's Anatomy when there was still Derek Shepherd, oh my gosh. It was at this time when all of the whole things that I've watched in Grey's Anatomy kind of like swam back in. And at this time, my brother-in-law Justin and my sister-in-law Deanna and their youngest one Justin Jr. was with us, and we were like all talking about it, and we were wondering if it was kind of like Derek Shepherd. So that night we finally met the neurosurgeon. He was amazing. His name is Dr. Elton. I had to say it because you can search about him. And he has done surgeries for the past 20 years. And when I asked him if Athena's case was rare, he said it was not uncommon. He has seen this on other kids her age in the same areas, which is surprising to me because it happens in peds, and it's just crazy. Anyway, so that was November 25th when we first saw him, and he was like, I don't know about being Derek Shepherd, but neurosurgery. So the surgery was scheduled on November 27. It was about like 8 to 10 hours of surgery. Just imagine 8 to 10 hours waiting and waiting and waiting and waiting. The waiting. It's like the agony of waiting. So so when after the surgery, he said he's confirming that it was medulloblastoma, but it was not touching the brainstem, which was another sigh of relief, because he said back then that if it was in the brainstem, he's not gonna try and chase it, because if it would cause injury on the brainstem, that would cause her respirations, her ability to swallow and all that. I mean, walking, the balance can be regained or retrained or relearn, but you cannot relearn breathing. It's a good thing that the mass was growing around the brainstem. It was not attached to the brainstem, which was really a big sigh of relief at that time. So that was November 27. And we waited and waited throughout that night, because they wanted to do a repeat MRI. I think it was MRI or CT scan, to see if they were able to get all of it. But he was positive that he was able to get all of it. At 12:30, they did the procedure. Around 4, no, actually, around 4 a.m. or like around 8 a.m. No, not 4 a.m. It was that time when his resident came into our room in PICU, and he said there was still a 1 cm tumor left. And I was like, without thinking again, I was like, you know what? Just take it out. I want it out. I want it, all of it out. He said, when he actually said that the location of the rest of the remaining of the tumor is just like easily accessible. And I was like, just take it out. I don't want it. I don't want it in her brain. I'm consenting. My husband may say some things, but he's consenting too. We want the tumor out. So that's what we did. So she had a repeat surgery. And the only thing that I asked, like, what are the risks of reopening? And they said, well, as you know, reopening an already closed incision, possible infection, but at the same time, she was already on cefepime. She's already on that antibiotics, and just go ahead. I told them, just go ahead and do the surgery and take it out. So I can't remember what time it was, but it was before shift change that she was done and back in the PICU. And we thought that it would be a good idea to get extubated. But at the same time, like even us wanting her to be extubated and breathing on her own, it was a lot. It was a lot on her body. At the same time, she has that tumor. She has that 5.3 cm tumor that was growing in her brain, that it took her brain a little bit more than 24 hours to recover. It was something so big that when it was taken out, that needs a little bit of time to recover. That's what happened. She got extubated that night, and for 13 hours, she was having lots of dyspnea, apnea, lot of nya. Yeah, her sats are dropping. So on November 29, that was a Friday, there was a code event, and it was something so hard that my husband and I had went through. There was that time, that morning, like I said, she was just like desatting, and she had, from what they said, it was a respiratory code event. Her respirations are just like dropping as well, and we got woken up because of that. When everybody was like trying to swarm in her room, I told my husband, let's just go out and go by the nurse's station, just right in front of her room when we were in PICU. And I was like, please don't close the curtains, don't close the door. I just want to see what's happening. I want to be watching it. This is also the time when my husband had learned to read vital signs. But at that point, he didn't know if it was the heart rate, the pulse rate, the RR, the SATs and all that, the blood pressure. So I told him, just read me the colors and tell me the numbers and I'll be fine. That morning, they had to, they already had the rapid response team, but then it was turned to code blue because her heart rate went down to 60, and they had to call anesthesia because she was just like not breathing so well. So they had to reintubate. They even had to do central line in the femoral artery. It was just so much. And if you watch other shows where there's code events like this and a family member cannot leave the room because they were just like being hysterical or anything, for some reasons at that time, me and my husband are unexpectedly calm. Like we are handling it so well, not knowingly that deep inside we're like numb and like crushing inside. I don't know. My husband said that being in the medical field, being a nurse, might be a blessing and a curse at the same time, because you know things at the same time you know things. You know what I'm saying? um, um, you know what's happening, and you know what could go wrong and all that. But it's a good thing that whenever they did the CPR on her, it was just like a minute, and they gave her epi and she responded to it. I was fine. And there was a doctor that was giving updates from time to time, and that kept us calm at that point. What drive me crazy was then when Chaplin came by and he was like, I'm here if you need to talk in times like this. And I was like, respectfully, I do not want to talk to you. I want to be focused on my daughter. I don't want to talk to you. That's how I told the chaplain. And my husband was like, nope, not talking to you right now. Yeah. Now I could laugh at it, but during that time it was so hard. Like I said, it feels like my heart was being broken into pieces at that time. When they have recovered her, she did okay. When they said that you can go back in and check on her, be with her in the room, I told my husband, I need to lay down or else I'm gonna pass out. Before then, I was able to call my mom. My aunt was with her, and so they came in that day. They were able to let us go to sleep. My husband did not want to leave Athena's room, so it was my mom and him. He was sleeping on a recliner. I was in the waiting room with my aunt, sleeping because it was just too much at that point. So around like 3 p.m., 4 p.m. that same day on November 29, I heard my mom knocking on the glass window in a waiting room, and he's like, you need to come now. Like, it's happening again. And I got the double doors open. It was just like a scene in the movie. Like, for real. It was just like a scene in a movie. So my mom was with us. It was crazy because me and my husband knew where we need to stand. So we were back at the nurse's station, and my mom was like right in front of us. my husband had to grab her and tell her to sit down by the nurse's station, because whenever I told you earlier, it was that family member that sometimes you just can't handle your emotions and you just want to be with that patient. I think that's what's happening at that time. But anyway, she had another code event. Her heart rate went down again to 60, and they just had to revive her again. This time it took them 2 minutes and then another round of epi, and it's a good thing that she responded again. No chaplain. Yeah, no chaplain at this time. But I mean, it just helped so much that there was that doctor that was giving us the updates and just how do you say it, reassuring us that they're doing all that they can to save our daughter. The other thing that I remember asking them is their brain activity, because of all the things that I've watched in Grey's Anatomy. Whenever they check the pupils, I also asked them, can you please check her pupils? Are her pupils constricted or dilated? Because if it's blown out, dilated, it's bad, right? But they said pupils are okay. It's still constricted because of all the medications that they've given her. So, and then like I said, she responded on the epi and she was fine. That night, my husband and I decided not to leave her room, because apparently if he was sleeping and I'm sleeping, Athena had to do some temper tantrums. So my husband and I called the code events as her temper tantrums, because apparently she did not want mommy and daddy going to sleep. She just wants mommy and daddy with her in her room. So at that time, we just didn't want to leave her room. Like, we didn't want to leave her at all. So there was that. She was intubated from November 29 to December 4. Um, the time that my mom got back, because it was my mom's birthday, December 4th, the time, because they went home, when she got back and she saw Athena, and I was like, happy birthday. Um, she saw Athena extubated and breathing on her own, doing well. Let's back up a little bit. So they had to do like a paralytic holiday, because she was on paralytics, she was on morphine, she was on Presidex, um, everything for her not to pull her ET tube. And they did that. They did like the 30 minutes, like during nighttime, well, around like 3 a.m. or 4 a.m. And they did it again around 8 to do like a 1 hour if she will be able to breathe on her own with less settings on the mechanical ventilator. And this time my husband is napping and I'm the one watching the mech vent. And I was like, why is her respirations going down to 10? And then it was 9, and then it was 8, and it was 7, and it was 6, and then all of a sudden it went back up to 40, and then 50, and then 60, and she was just like breathing on her own. And I remember this nurse, he was a very tall guy, and he has a deep voice. He's a little older, but compared to Athena being small and sedated and intubated, he was like, I need some help in here. This girl wants to be extubated. She's gonna pull this tube out. It was just a funny time at that time. And I was like, when she was getting ready to be extubated, my husband was still sleeping, but I told the nurse, I was like, let's play the Baby Shark metal version. And we sure did. We were playing that and they helped her. She extubated beautifully. They put her on high flow oxygen at that time, but she did so good. And after that, when my mom, like I said, when my mom got there, I was like, happy birthday. And I remember her posting on Facebook, saying, thank God for the gift of life. And it was just very timely. Like I said, it was a gift of life. Yeah, I need to catch my breath. That same day, we were moved to a different room, just a change of scenery. And that was December 4. Around December 10, we were back up to the oncology floor, because that's where we're gonna be at for her chemo treatments. Since medulloblastoma, we were at that time we were just waiting on the stage of the cancer, of the grade. I think it was grade 4. It was grade 4 medulloblastoma. That's the only time that I know, but we didn't know what the genetic testings are, the stage of the cancer, and all that. And so December 10, we moved up to the oncology floor. It was in 5 Children's. And this was the time at midnight when I just got back on the recliner, wanting to go to sleep. And then I got woken up because they said, oh, we're finally going up to a room and we're getting out of PICU. And I was like, great, why at midnight? But anyway, we got back to the room. That was December 10. December 12 was my husband and I's anniversary. That was our 4th anniversary. Let me back up a little bit, because December 8 was actually Athena's birthday. 3rd birthday. Why did I skip that? Oh my gosh. Anyway, December 8. It's, I don't know if this would sound selfish, but we still celebrated her birthday. We sure did. It's just that we didn't post a lot about it on Facebook, because I did not, like I said back then, I did not want to post these things because it was something that I think, or I thought, that did not happen, but it sure did. And But yeah, she turned 3 on December 8th, and then December 12th was our anniversary. And December 13th, she had her port placement done for her chemo, and she has a gastrostomy tube because at that time her vocal cords is just injured. There's a lot of swelling, and of course she needs nutrition, so she needs to have the G tube. December 20 was when she started her first chemo. um, if you want to know the meds that she's got, just message me. But anyway, she has her first round of chemo. um, the oncology doctor told us and walked through us the course of her treatment. It has like 6 cycles actually. 3 cycles for induction phase, and then a break for like 2 weeks. Was it 2 weeks? Or no, a month. I think it was a month. And then 3 cycles of consolidation phase, which is the high dose chemo plus a stem cell transplant. She did an autologous stem cell transplant. They did the stem cell harvest on her on January 22nd. That was before her third, that was her before third cycle of induction phase. They wanted to make sure that she has good blood cells to harvest, so it will be on a stem cell rescue for the high dose chemo plus the transplant, which is what she's doing now. At this point, she's already at her 6th cycle, which will be on May 4th. And her last transplant would be on either May 7 or May 8, depending on her counts. But if you're watching it now, it will be at that time. So she already gone through 5 cycles and then one more with stem cell transplant. She has done 10 days of rehab inpatient in a different hospital. She's been doing well with OT and PT. She's been walking, as you have seen on her videos on my Facebook page, and everything that we post. So after her last transplant, we would have to wait for about like 8 weeks, because when she recovers from this next transplant, she'll be able to go home, and we'll just have to watch her counts, and we'll have to continue her OT and PT. And then again, we have to start like maintenance chemo, which will be through her G tube, since we can give it orally, but it's easier to do it via the G tube. So it will be about another 6 months, but at least she will have to do it at home, not inpatient, which we are all so excited about because we want her to be back home with us. And that's it. It was just like a long road. Sorry for a little bit of time explaining things, but I'm sorry. I'm not sorry. That's what we've been through. I was just able to make a vlog like this since, like I said, I was able to get out of the hospital and try to explain it to those who are just finding out about Athena. We want to thank you also for all the prayers that you've been sending us. And it was just all glory to God, because seeing her, like I said, seeing her every day recover is seeing him work wonders. There's that one time that a person asked me, like, how are you handling this so well? And I was like, I'm not worried, because I know who God is. I know that I'm confident in him, that he will do miracles, and he is taking care of Athena, and that that's the reason why seeing Athena recovering well, we call her resilient Athena, of all the things that she's been through. Like I said, it's also the work of God, and it's all glory to Him. And we want you to know, whoever may be going through some stuff, just place your hearts and faith, and draw strength from God. He will get you through this. So that's it. A little bit more information with regards to Athena's tumor. The tumor was grade 4 medulloblastoma. It was very localized. It was totally resected on November 28. It was no metastasis on the spinal cord or spinal canal. There's no MYC gene. MYC gene is when it was described how the genes are mutated, how fast the tumor can grow, or how her cells are moving. She doesn't have that gene, which is another side of relief. And we didn't have to do radiation on her, but we're still doing the high dose chemo plus the stem cell rescue. And yeah, from what I've heard back then, I know like the staging of cancer was like stage 1 to stage 4, I don't know, end stage. But with her, it was somewhat M0/M1. The stage, I think it was like 0 or stage 1, I'm not sure. But she was on the, it was very localized. It did not metastasize on other areas of her organs. And every time she does like scans and procedures, she's doing better every time. So if you made it this far to this video, on behalf of my family, we want to thank you for all the love, the care, and the support that you have shown us through your kind words, through your prayers, which are highly appreciated. We thank you so much. To our family and friends, we love you so much. We can't wait to see you again after all this coronavirus lockdown. But for now, I'm sending you all virtual hugs. Most specifically, I want to thank God. All glory to Him for all the miraculous things that He has done for our family, for Athena, getting her recover, giving her all the strength to get back up again. He's truly amazing. He works in mysterious ways, and it's for our own good. This is our story. This is Athena's story. We just can't thank you guys enough for all the things. If you are interested in watching more of our videos, especially with Athena's recovery, I think the next video that I will do is more on Athena, showing more of her. Just like and subscribe, and I promise it won't be this long again. I promise. So thank you for watching, and see you in the next videos. Love you.